Welcome to the podcast. My name is Dr. Noor Gajraj. Let's talk about type 3 diabetes, understanding the brain-sugar connection in Alzheimer's. Type 3 diabetes is a conceptual term, not a formally recognized clinical diagnosis by major medical organizations like the American Diabetes Association or the World Health Organization. It is a hypothesis or a proposed classification primarily used by researchers to describe Alzheimer's disease as a form of diabetes that affects the brain, specifically characterized by insulin resistance in the brain. Insulin is more than just about blood sugar. Synaptic plasticity, it's crucial for strengthening connections between neurons, which is fundamental for learning and memory. Neuronal survival, it acts as a growth factor, supporting the health and survival of brain cells. Neurotransmitter regulation, it influences the balance of various chemical messengers in the brain. Amyloid beta clearance, insulin signaling is involved in the clearance of amyloid beta, a protein that forms plaques characteristic of Alzheimer's disease. When the brain becomes insulin resistant, the type 3 diabetes hypothesis. When this happens, even with normal insulin levels circulating in the blood, the brain's neurons struggle to respond to insulin signals. This leads to a cascade of detrimental effects that mirror the pathology of Alzheimer's disease. Glucose hypometabolism. Brain cells can't properly use glucose for energy, essentially becoming starved. This energy deficit impairs vital brain functions like memory and cognitive processing. Chronic neuroinflammation. Insulin resistance triggers and perpetuates inflammation, specifically within the brain, damaging neurons and contributing to the disease process. Oxidative stress. The impaired metabolism generates harmful reactive oxygen species, leading to oxidative stress and further cellular damage. Amyloid beta and tau pathology. The impaired insulin signaling directly interferes with the brain's ability to clear amyloid beta plaques and can promote the abnormal phosphorylation of tau protein, leading to neurofibrillary tangles, both hallmarks of Alzheimer's. Taking action, protecting your brain from type 3 diabetes, dietary changes. Emphasize a whole foods diet low in refined sugars and highly processed carbohydrates. Focus on healthy fats, lean proteins, and plenty of fiber-rich fruits and vegetables. Consider diets like the Mediterranean diet. Regular physical activity. Exercise improves insulin sensitivity throughout the body, including the brain, and promotes beneficial brain-derived neurotrophic factors, BDNF. Quality sleep. Poor sleep is linked to insulin resistance and impaired amyloid clearance. Weight management. Maintaining a healthy weight reduces inflammation and improves metabolic health. Stress reduction. Chronic stress can impair insulin sensitivity. I hope you found this talk informative. Please consider buying my new book, 100 Pathways to Longevity, and subscribing to this channel.